People shouldn't be embarrassed by hemorrhoids because everybody has an anus and everybody has hemorrhoids. Everyone that comes into my office thinks that every problem around the anus is a hemorrhoid. And I've seen people come to me that have been diagnosed by other physicians with a hemorrhoid, quote unquote, when it's been everything from a skin tag, which is really just a piece of skin, all the way to cancer. And so there's a lot of misunderstanding about what hemorrhoids are and how best to treat them, even in the medical community. Hemorrhoids are normal anatomic structures. Everybody has hemorrhoids. Babies have hemorrhoids, fetuses have hemorrhoids. Hemorrhoids are vascular structures around the anus, and their normal function is thought to facilitate continence by closing out the anus to help the sphincter muscle when you're lifting something, for example, so stool doesn't leak out into your shorts. But they give us trouble typically when, in our Western lifestyle in particular, where we tend to have hard stools from insufficient fiber in our diet, or if we strain to have bowel movements, or if we spend excessive periods of time on the toilet. Some people like to keep a library next to the toilet and sit for half an hour, 45 minutes in preparation for a bowel movement, and gravity then pulls the hemorrhoids out and gives people trouble. There's internal and there's external hemorrhoids. Typically, internal hemorrhoids cause problems of bleeding, and external hemorrhoids are what people fear, and it causes swelling and pain most commonly. Obviously, each of them can have some elements of pain or bleeding as well. First recommendation for most people that come in complaining of hemorrhoids is to increase the fiber and water in their diet to a point where the stool becomes soft, and to change some of their bowel habits so that they're not sitting for excessive periods of time in the toilet, where they are not straining to have a bowel movement. It's important to know that most people that have hemorrhoidal problems don't need surgery for their hemorrhoids. They may need some treatments, but oftentimes don't need surgery.